Hi friends, welcome to nursinggillfish. In our channel, what are the facilities are there? Like example, we are having the prometric, Haad, DHS, Nclex, aiims, RRB, ESIC, all central government, state government exams, question paper, and also you are having the different mock exam available in the target all exam in the app also. And if you have any other doubt, you can feel free to ask and join my channel. We can go for the question it is. A construction worker was brought to the emergency department and admitted with the diagnosis of heat stroke due to strenuous physical activity during hot weather condition. Which action should the nurse take it as? Option A, immediately immerse the patient in cold water to reduce the patient temperature. Option B, administer on antibiotics such as aspirin or acetaminophen. Option C, place ice pack to the neck, axilla, scalp and groin. Option D, encourage foods and oral fluids that contain carbohydrate and electrolytes. What you have to do for it is actually heat stroke. Why it has happened? Because of the strenuous activity. So what is the remedies you have to do for the paracetamol or cold water or fluids or maybe the neck? What you have to do for it? Yeah, option C, place ice pack to the neck, axilla, scalp and groin. That will be the correct answer. You should not immerse the patient in water. It is a very wrong method. So you have to do only the ice pack method. That will be the effective. Next question. 30 minutes after starting a blood transfusion, a patient develops tachycardia and tachypnea and complaints of chills and low back pain. The nurse recognizes this symptom as characteristics of patient என்னென்ன ப்ராப்ளம் இருக்குது blood transfusion பண்ணும்போது tachycardia, tachypnea and chills and low back pain. So nurse should recognize the symptoms characters என்ன problem அப்படின்னு சொல்லிட்டு we have to be find out. So according to the symptom when it was happened, it is according to the condition it was hemolytic reaction. Why? Because the blood is going to be coagulated, then only these all the symptoms are going to happen. So the correct answer is option D it is. Next question is, as a part of the treatment given to a child with leukemia, the child is placed on reverse barrier isolation to option A, protect the child from injury, option B, protect the child from infectious agents, option C, provide the child with quiet environment, option D, keep the child away from the children. Actually what you have to do, the patient is having leukemia. If it is the person is having leukemia, what is the most important case of what has happened there? Yeah, infection it is. So that is why what you have to do, isolation is very important. So what is the correct answer here? Leukemia, the baby is having leukemia, you will get a frequent infections also. So the correct answer is option B, protect the child from infectious agents. That will be the correct answer. Next question. The rationale for having the patient void before on abdominal paracentesis procedure is to option A, minimize discomfort, option B, avoid abdominal distension, option C, prevent bladder puncture, option D, reduce infection rates. So what is that it is? The rationale for having patient void before abdominal paracentesis. Why? Because when you are going to do the paracentesis, so where you are going to do in the abdomen. So abdomen we are going to take the fluid. So that time what will happen? Bladder will be punctured. So that is why we are telling the patient you go for washroom. That means void the urine it is. So that is why option C, prevent bladder puncture will be the correct answer. Next question. The best time for the nurse to teach on anxious patient about the patient control analgesic pump would be during which of the following stages of patient's care? Patient is having controlled anesthesia. Okay, va? So option A, post-operative, option B, pre-operative, option C, intraoperative, option D, post-anesthesia. So what could be the correct answer? Can you guess it that? Yeah, what you are going to do? You are going to teach the patient about patient control analgesia. So when you are going to teach it is Usually before surgery. That means what is the correct answer? Yeah, option B, preoperative will be the correct answer. Okay, fine. Next question. To maintain the airway and promote respiratory function, the best position for the nurse to place the unconscious patient in the post anesthesia care unit is option A, supine position, option B, lateral position, option C, Trendelenburg position, option D, Fowler's position. Actually, what is the question here? The patient is unconscious. Another is patient undergone surgery also. That is post anesthetic care unit she was there. So that means we have to maintain the airway and respiratory functions also. So what you have to do? Actually, after surgery, what will be coming? Secretion from the mouth. So it will be affect the breathing. So what we have to do for the position for this recovery position? That recovery usually what we are going to do? We are doing the lateral position. So option B will be the correct answer. Okay, fine. Next question. When the postoperative patient return to the surgical unit, the priority is to first, what are the priorities we are going to assess? Option A, assess the patient's pain. Option B, measure the patient's vital signs. Option C, monitor the rate of the IV infusion. Option D, check the physician post-operative order it is. What you have to do for it is, whenever you are receiving the patient in post-operative unit, what we have to do for it? Okay, so main thing is we are going to do, what is that? We are going to pain IV post-operative, nothing. We are going to assess the patient vital sign. First up, we are going to assess the consciousness. Second, we are going to assess the vital signs and secretions it is. So option B will be the correct answer. Next question. If you like this video, please like and subscribe my channel, and same time it is, and you're having the target all exam in the website. You have all the questions related this. So if you want, you can monitor, and if you have any doubt, you can comment on my. If you want any other guidance, you can join my channel also. Okay, fine. Next question. When taking routine post-operative observation on a patient who underwent on exploratory laparotomy, the nurse planned to monitor which important findings over the next hour it is. Actually, patient undergone routine post-operative observation. Okay. And the exploratory laboratory, the surgery is laparotomy. The nurse planned to monitor which important finding over the next hour it is. Option A, zero sanguineous drainage on the surgical dressing. Option B, blood pressure of 105, 65 mmHg. And option C, urinary output 20 ml in the last hour. Option D, temperature 37.6 degrees Celsius it is. Actually, already told this is related to what is the surgery it is? Laparotomy. The patient undergone post-operative period. So usually which is we needed to think about it. Temperature always rise, and blood pressure are told it will be vary. Drainage you have to see, and also urinary output. In this, what is they are given that urinary output is 20 ml per hour. So what is that? Usually how much should be? Every 1 hour urine output should be 50 to 60 ml. If the person is having less than 30 ml, that will be called it as decreased urine output. That means you have to be monitor the patient, increase the IV fluids, or you have to monitor any damage to the bladder or not it is. So the correct answer is option C, urine output less than 20 ml. Next question. A patient has been taking aluminum hydroxide daily for 3 weeks. The nurse should be alert for which of the following side effect it is. Option A, constipation. Option B, flatulence. Option C, nausea. Option D, vomiting it is. Actually, what is the purpose of taking aluminum hydroxide? It is related to the ulcerative patients it is. Okay. So the patient, if you are taking this aluminum hydroxide, what will happen that it is? It will be affect the motility of the intestine it is. So automatically what will have the persons having, what is that? Constipation. Yeah. So that is why answer A is a correct answer. At last question, a patient with severe protracted vomiting will often have what electrolyte abnormality? Option A, decreased potassium and decreased chloride. Option B, increased sodium, decreased chloride. Option C, increased potassium and increased sodium. Option D, decreased sodium, increased chloride it is. Actually, severe protected vomiting it is, and with the electrolyte imbalance it is. In which conditions you will have a protected vomiting it is? Yeah, it is usually it was happen in the potassium and other type of minerals and electrolytes also. So that means which will be the correct answer? Can you guess it? Yeah, decreased potassium and decreased chloride will be the correct answer. If you like this video, kindly like and subscribe my channel, and also if you want any other doubt or clarification, you can contact me. This is Jelfish Meena. Thank you for watching.